What can pelvic floor therapy do for you?
Today we talked to Janice Bacak, owner of Resilience Physical Therapy. She talks to us about all the things that are connected to your pelvic floor, including your emotional health.
As a health coach and a wellness coach, we ask the questions so you get the answers. So let's get started as we ask.
Wait, what?
Hi, Leah.
Hi, Kamna. Oh my gosh, as I was reading the intro, I don't remember know if I asked her Janice how to pronounce her name. Did I say it right?
Pretty close.
How do you
Not
say
many
it?
people. It's Basak.
Basic.
Oh,
Yeah, I
Okay.
know.
Basak.
Yeah. It's about 10% of the time people say it. It's okay.
Basic. Okay, well, we're so excited to talk to Janice today. Janice is a doctor of physical therapy and owner of the Wellness Pelvic Physical Therapy in Beachwood. Her journey in physical therapy started 25 years ago after graduating from Washington University in St. Louis. Janice is a board certified clinical specialist in women's health physical therapy and provides expert level care for adults at her Pelvic Health specialty clinic. Resilience offers individualized programs in pregnancy, birth prep, and postpartum return to fitness, as well as pelvic pain, bowel and bladder issues, pelvic organ prolapse, pre and post operative care, and perimenopause, menopause. Outside of work, Janice enjoys spending time with her husband and two children, as well as staying active with hiking, weightlifting, yoga, and biking. Oh my gosh, how many questions do we have
Welcome.
already, Kamna?
I was writing down because I'm like, I want to ask about that. I
I
want to ask
have
about
dumb
that.
questions
Yeah.
too that I can't wait to ask. Listen.
There's never a dumb question.
Oh, good, good, good.
I'm so excited.
All right.
Well, tell us, let's start with who you are and your training and overview of what you do.
So yeah, I'm Janice Bacak. I've been a PT for 25 years now. I had a windy road to pelvic health. When I first graduated, I said I would never work in pelvic health. Like who would do that? And then I had my kids and had some issues, and like a lot of pelvic physical therapists, and ended up thinking, okay, this might be my passion area. I've worked in ICU and hospital and spinal cord rehab and like regular orthopedics, nursing home. My life took me to different states and different experiences. And I do feel like they made a difference with pelvic health where I am today. But mostly now, I am in a private clinic. I own a small clinic of my own, Resilience, and I've been for 5 years. I've been in pelvic health for almost 15. So my kids are almost 19 and 16. So some issues after I had them again brought me into that, and I worked at a hospital system for a while. And a couple of years ago, I did an additional board certification. So physical therapists have. Sometimes they go on to do some specialties like orthopedics or geriatrics. And I did women's health, which is actually pelvic health. That includes men's health. So
Okay.
I do
Oh,
treat some men and women for pelvic issues.
Okay, here's my first dumb question.
I
And
know.
I saw this while I found you on Instagram. I believe it was Instagram. And I think you posted something about men and I go, I didn't know men had a pelvic floor. I mean, that sounds so stupid.
No, most men don't know they have a pelvic
I
floor. So
did not know they have a pelvic. I was like, wait a minute. I'm like, I thought this was only like a woman like thing. So men have a pelvic floor?
they do. Yeah. So it looks about the same, just one less opening. So it's pelvic floor issues I see for men are pain, sometimes leaking, and that's usually after a prostate surgery for cancer. Like sexual dysfunction are big areas of pelvic health that I see men for. So I've
So
seen a lot of people with urinary urgency frequency issues recently.
that's
Wow,
what
you pelvic floor covers a lot of
I,
things.
I know.
It
So
does.
you said pain, like I know we're jumping around, so maybe I should.
That's okay.
Okay, where do you mean pain? Like how do you know what pain?
Yeah, so the pain could be in different places. It could be pain, maybe, with just thinking about like terrible period cramps, that are crazy bad. It could be pain in the pelvis, pain in the hip, pain with having a bowel movement, pain with urination or as the bladder's filling. So pain with sexual activity. So some things are normalized, like, oh yeah, that's normal to have, or pain with a physical examination. There shouldn't be pain with it. So those are things I work with a lot of people with pain.
Wow. Okay, go ahead.
I want to ask a question, but I think we need to do a little understanding before we get to the
Okay.
second question.
Mhm.
What is a pelvic floor?
Okay, there you go. Let's start there.
That's a great question. So when we say pelvic floor, we can mean muscle, so the muscle and pelvic floor muscles is what people think about with urinary leaking, but the pelvic floor is really everything in the side of the pelvis. It's like a bowl. So we do have some muscles and nerves, blood vessels and fascia, so organs, so that all can be like pelvic floor. But when we're physical therapy, we're looking more at the muscles, all of the above, but we're really looking like how are the muscles functioning. And not just pelvic floor, we think of like the muscles surrounding. So there's multiple muscles that attach to the pelvis, like your abdominals, your inner thighs and back. So all of those have influence on pelvic floor as well.
So like your hips too?
Mm. Yep, definitely hips. There's one hip muscle that actually goes into the pelvic floor. So oftentimes I'm working not just at the pelvic floor, but looking at, maybe they have issues at the pelvic floor because of hip tightness or weakness or something related to decreased mobility. That could be the driver causing some of the pelvic floor related symptoms. Yeah.
Okay, here was my
So,
follow-up question. And I'm sorry to ask this, but I think I need to know. So you're a doctor of physical therapy, right?
yes. Mhm.
How is what you do different than for women, in particular, a gynecologist?
So gynecologists are definitely and I mean, there's OBGYN.
Mm.
So definitely they're working more on they might not be assessing muscles per se. Some do, some don't. I've done some in-services for physicians to say like, hey, this is how you would do just a screen to say if someone has pain, like, hey, those would be people that would benefit from physical therapy. So they're looking more at the organs, maybe doing that well female exam, where I don't palpate ovaries. I'm not looking for abnormalities
Mhm.
with the uterus and things like that. I do use ultrasound more for like muscle, so people can visualize how
Okay.
their muscles are working, but I don't scan for trying to rule out any issues.
So in an ultrasound, can you see if muscles are like out of whack or not tight, or you're just doing it more to show me where my muscles are?
Yeah, where your muscles are, but how they're working. So oftentimes I'll use the ultrasound around the bladder region,
Okay.
so people can see up on an iPad. This is your bladder. So if it's pretty cool. So if someone does a pelvic floor contraction, then you can see a little lift and say like, oh yeah, there's my muscle. Or if what they think is they're doing a contraction and they're actually maybe like pushing down instead, then they could actually
Oh,
see
how
it.
beneficial would that be?
Yeah.
So
So
because like I don't know, I think right now I'm doing something, but I might be doing
mhm.
nothing.
Right. And so, one way that a lot of pelvic physical therapists work, our training does include doing an internal examination.
Okay.
So, that is just an option. It doesn't mean if someone wants to go to pelvic physical therapy, they don't have to have that portion. Sometimes it does offer some good information, but that doesn't always translate to someone like knowing what's happening into their body. So, that's where the ultrasound is helpful. So I might feel like, oh yeah, you have a nice contraction, or oh, you're bearing down instead of contracting. But having that visual really helps the person see, oh wow, it's like this is I mean, how can we change it? And they can change it and see how that changes it on like an actual screen in real time.
Right.
Okay, I want to share a very embarrassing story. Okay, I was
Okay.
taking a walk today and I didn't think I was going to make it home.
Okay. You almost
I
peed your pants?
I thought I was going to pee my pants because I drink a
Okay.
lot of water in the
Mhm.
morning. I know that's one of the pieces that you deal with, but how
Mhm.
would someone like me or Leah know that we need to come see you? I mean, that seems like a very typical thing for a woman who's had children, right?
Yeah, I mean, it is like what is normal changes, and what is something that maybe you can have some help with. I'm in the camp of it's almost, I mean, a lot of people would benefit from a screen, especially after changes to their body and even changes with life stages like post-birth or into perimenopause and menopause as our bodies change to see like how we can best use the muscles in our body. So there are some times where there's some changes from birth that can create some change to the anatomy that maybe pelvic floor physical therapy wouldn't be helpful. Like working, you could have the strongest muscles, but the changes in anatomy make it more likely to leak. So there's, one portion there. So part of my job is to figure out who can I help and what is the best way to help, so we're not making expectations that like, okay, you're failing physical therapy. No, sometimes
Right.
people do need a little extra help. And that's where even a gynecologist that deals with, or a urogynecologist who deals with more like the surgical aspect could be helpful.
Oh, okay.
Okay.
Something like urgency, when you are, say you do drink, you had a lot to drink and you overloaded your system, that may be something normal. I find that sometimes I've had patients that say, I have urgency and I do have them do a little bladder diary. And it just so happens that they drink like like a liter or more in a short period of time. And then they think, well, since I had to pee an hour later, that something's wrong. Well, I would say that would be normal. So
Okay.
for you, if you had a lot, like I always use I tell my patients like stories about myself. I'm like, I drink coffee and have water and a smoothie in the morning. And so I might actually pee like several times in the morning. And
Mhm.
that would not be abnormal because
Oh,
I'm
thank
taking
goodness.
in tons of fluid. So,
Okay. So
and I have a full bladder, so I have to go.
what is abnormal is like if you sneeze and you pee.
Yeah, that would be one part. That would be
Coughing.
kind of like they call it stress urinary incontinence. So like leaking with exercise, leaking with sneezing or coughing, things like
Sometimes,
that.
okay, so I'm gonna to be honest with you. Like sometimes I pee and then I get up and I still pee.
Yeah. So I mean, you might not have fully
And
emptied.
I think it is, but then I just stand up
Hmm.
or pee come. Like, do you know what I'm saying? Like, so I
Absolutely.
feel
Yeah.
like what I have is more than just like, I have to run to the bathroom all the time. It's not like that. I have like literally probably like problems.
Like after you urinate.
Yeah.
Yeah.
Well, it's
I
all the time.
usually I'll like deep dive in that sometimes and say, like, is it that you are like on the toilet and you have something else going on? So you've learned to like pee as fast as you can,
Yeah. So
like
is
power
that
pee.
bad to push it out?
So I try not to do like this is bad or this is
Okay.
good. So
Not preferred.
not preferred because you might your bladder is a balloon, that's a
Okay.
muscle, and it is contracting itself. So you don't really need to help it by pressing more. Now,
What if I ruined it?
no, you didn't ruin it. And there are
Good
times where
question.
when my kids were younger, where I was like, it is quiet and I need to pee as fast as possible because I know something's going down. That's where I say it's not bad. You're not ruining anything, but like as a habit, you may not be emptying all the way. There's still
Yeah.
some urine left in the tube where you pee, where you stand up and then it comes out. There's other times too, and that's why I'm not diagnosing you, but there where after birth your sometimes organs shift into some different places. And
Yeah.
so sometimes I have people even move around a little bit on the toilet and
I've
then
noticed
they
that
go a
different.
little
Yeah.
bit more. And then that helps. So when you stand up, you don't end up leaking a
Okay,
little bit.
good. I thought I
Yeah.
was crazy because I'm like, when I move, like, oh my God, you just made me feel so much better about
Yeah, I
myself.
know.
Yeah.
I was like,
Well,
oh
that's
my
the
God.
goal in pelvic therapy is like sometimes things are scary, and that's why people do not bring it up to their doctors. So they don't even know that there are some options that don't include medication or surgery or just wearing a pad for the rest of your life.
Yeah, I don't want to do
Mhm.
that. It's just
Yeah.
not, doesn't sound exciting to me.
Yeah.
Well, and
So
it's embarrassing to talk about this.
Yeah.
yeah, and that's as our medical. We should be asking the question. So I ask the questions all the time. I have an intake form. I have like tons of questions. People can answer anything they feel comfortable. And
Mhm.
usually when they come in, they say, well, this might be too much information. But like usually then it's like, okay, that's
You're
what I
getting the
want
good
to
stuff.
hear. Yeah,
Yeah.
that's the key to their problem. Or like this is probably nothing big, but it's totally the thing that's helpful for me to help them. So, but it's just creating that environment. I
Mhm.
have some people that say like, you gave me the permission to talk about this, having that like safe space where there's no judgment. I always say I want to put on my wall like a script that says like there's never too much information. So
Yeah.
That's
you
good
can
that's
just
comforting to know.
yeah. Yeah, because
Oh,
it is hard to talk about these things. And if I ask a question, I might say, like, you don't have to answer anything you don't feel comfortable at me asking. And so I'm inviting them to as
Yeah.
well.
just to sort of finish up this topic, maybe, or maybe not, I don't know. But if a lot of our clients will talk to us about not drinking water because they're scared they won't be able to find a bathroom. Do you have thoughts on this?
Yeah, I can totally understand why someone would want to do that, where they feel they might be peeing their pants in a place where they don't want to. So again, I don't say like, oh, that's bad. In general, if people are restricting fluids, that may be something that is irritating their bladder more. So I then maybe come up with some solutions, like how can you maybe it's drinking a little bit at a time throughout a span instead of saying like, oh, I haven't had much to drink. Here, I'm going to drink a 16-ounce bottle of water. Then you're more likely to have to access the restroom. So maybe doing some drinking that 16 ounces over 2 hours can help their body process that fluid, use it in their cells, and maybe not have to run. Still getting the fluid, but just in maybe a prolonged way. So
What a
I tried to
smart
come up with
answer.
solutions. Yeah.
Yeah.
So
Yeah.
I did. Yeah. I like life doesn't always fit in perfectly to education. So I ask a lot is like, what is their job? Are they a nurse that can't use the restroom when they want to, or a teacher? And then
Yeah.
how can we come up with some
Uh,
solutions for
Or
that?
bus driver. We can't go.
Right.
We cannot, you can't park your bus when you got to go and just go to the bathroom.
hmm
You can't
Yeah.
do that.
So we might, say, minimize fluids right around that
Yeah.
time, not restrict, but maybe try to get it in a
Mhm.
different time. So it wouldn't be the time where you have the smoothie and the coffee and the
Right.
water.
Okay. So I think you posted, and I'm looking this up right now, at one time, and sorry if I'm jumping around. Constipation is a sign of pelvic floor problems.
Yes. Yeah.
Okay.
So
Why?
constipation. Yeah. Well, the organs are so close together. So the bladder again is like a balloon, and then behind you may or may not have a vaginal wall, depending on the person. And then there's rectum right behind that. So the rectum shouldn't be hold stool. It's a vessel that something moves through it to get out. So if people are constipated and backed up, that takes up some space and may push on the bladder and irritate
Oh,
the bladder. So that's where it could be something that drives urgency. It could be leaking, and it could be something that irritates and might be a source of pelvic pain. Hard stool hurts to get out sometimes. And if it's building up in the rectum, then sometimes it's hard to get that amount of stool out. And so pelvic floor doesn't like to have that huge stretch. It might come back in and kind of tighten. And so that's where it could cause leaking, or it may irritate pelvic floor.
So if you actually like work on your pelvic floor muscles, it could help relieve constipation.
Yes. hmm So yeah, so I do have people that there are a couple reasons for constipation. Sometimes, it moves slow through the intestines,
Yeah.
and then sometimes it gets caught up as it's trying to exit. So it's almost like it's being stopped by the pelvic floor. So and there are other people and there's some testing for this. It's not totally necessary all the time, but where they are. So this is a lot of information. So I hope you're okay learning about
Yeah,
this.
oh,
But
we're
so
sorry. We're all
excited.
in.
where people are actually having a bowel movement and they're trying to get a little push behind it, but they're accidentally holding it in versus helping it come out. So that would be another form of constipation, and maybe even caused by the pelvic floor.
And you don't
So,
know if you're holding it in?
yeah, some people are not aware of these patterns. So usually, then I'm asking questions like, how long has this been happening? And going back, like, what, what's your stool type? And I have pictures that I use to see, like, okay, maybe this is something they've experienced since they were 5, and they had some hard times with constipation back then. And here I'm seeing them as adults, and they think that was normal because everyone in their family was, like that, because we don't talk about it. Again, this would be
Right.
great information for middle school health classes to learn.
Yeah.
I know my kids, so I have a 16-year-old daughter. She was like, oh, just so glad that I could talk to someone about this and just know about my body. And so I do wish that was a part of just common education.
Finish what you're
Well, I have
saying.
people in their 60s or 70s that see me and they're like, why didn't no one tell me this?
That's how I feel right now. I'm really
Yeah.
feeling that way. Nobody ever
Yeah.
told me don't push your pee out. Ever.
Mhm. I
Oh my God.
yeah, it is a common thing that people think, and that
I
is
I have
normal. And
probably actually encouraged my kids, like, hurry up, let's go. Like, I'm sure I have.
yes.
Oh,
So
yeah.
yeah, knowing,
100%.
okay, you didn't ruin anything.
Okay,
So
good.
I like to see, like, okay, can we try to, your bladder does a great job at getting it out. Just take your time, let it do its thing. But again, sometimes there might be a reason, like, you hear, your kids hitting each other. And you're like,
Yeah.
okay,
Right.
I need to get out of this bathroom or someone fell.
Yeah.
So
So I want to ask you about something that I've read about how it's bad to stay on the toilet for so long. And I know some people spend an hour and on the toilet.
Are you referring to men?
I'm not saying anything.
All right, sorry, go on. Okay.
Um, is it bad to stay on the toilet for that long?
well, I
No,
guess
she doesn't, don't say, you don't have to say bad. Is it not preferred?
Sorry. Yes. Yes. Sorry. Yeah. I know you don't like that word. Sorry.
I think I've been guilty of like just spending time in the bathroom just to have some alone time.
Yeah.
Oh, yeah.
Not necessarily on the toilet. So first it's like seeing, are they actually on the toilet or are they just taking a break from life? So generally say about like if something's not, if it's not happening around 5 minutes, then time to get up. And ideally not bringing your phone in, and you're there to get a job done and then move on. So you're doesn't need an hour to do that. So I will sometimes work with people who maybe, like, because of their job, they don't like to have a bowel movement at
Oh,
work or at
yeah. Yeah.
school, and
Yeah.
they have to have the urge to go at an inopportune time, and they start holding it back.
Right.
And then they stop getting the urge until they like to go. So like they're like having to run to the bathroom. So sometimes I work with people and like, okay, your body does all these reflexes as you eat, you get up and you move around, and let's capitalize on those reflexes and help get you to learn the signals that you of what your bowel urge is. So I might have them get on the toilet 20 minutes after they eat, because when you eat, then things start moving in your intestines, and they may or may not have to go, but I have them sit for 5 minutes, and then sometimes they're surprised, like, okay, I'm starting to kind of reset my body, get myself back on a schedule. Or I say, like, don't spend more time than that, so you don't get frustrated, and so it doesn't, or don't bring that phone in. So,
The
and then
people who
go
are
back.
waiting for the restroom don't
Yeah.
get frustrated.
Yes. That seemed like a personal question.
No, not at all.
Like, never mind. Yeah, I have a
Yeah.
lot of personal stories I could share on that
Yes.
third topic.
Are you okay if I shift the vibe a little bit? When you and I spoke before, we talked a little bit about the connection to emotional issues.
What do you,
Can we go in that direction? Is that okay?
Totally fine. Mhm.
Okay, because
what do you mean?
I think emotional health and emotional well-being and perhaps eating disorders, I think you had said you had worked with. Is that correct?
Oh, yes. And part of it was I guess your title of Wait What, and wanting to make sure that, I do see people who have pelvic health issues, and they might have been told in the past, it was because of their weight. That was the main driver of their issue, and feeling very dismissed and not actually heard. And and oftentimes it turns out that's not the issue. so, um, that, when
Wow.
we spoke, it was that wanting to make sure that I was sensitive to that patients that I see,
So
and
it has nothing to do with your weight, your pelvic floor.
most oftentimes not. But there is some
Okay.
research to show with urinary leaking, there is a
Okay.
higher amount of leaking sometimes with higher body weight. But there are a ton of other reasons someone might have leaking. And that's what, as
Right.
pelvic physical therapists, that our job is to figure that out. And sometimes there might be that weight component, but it's generally not the only reason, which is sometimes the message that they get from other practitioners.
That's actually relieving too, because it's like, because that's not something you can fix like overnight,
Yeah.
sometimes, and like if there's exercises you can do, then that's so hopeful. Does that make sense?
Yeah, yeah. And I get, I mean, usually it's not the only thing that they're being
Right.
told is like the reason for weight loss. And there's definitely some components of like, I always make sure, that people are exercising in some way, not just for their pelvic health, but I look at like their health overall and through their lifespan, so that the outcome may be an impact on their weight, but that's not necessarily my focus.
Mhm.
Um, but I mean, I think, knowing all the reasons that someone might have the issue is helpful. So that now conversely, that pelvic floor does have is impacted by your stress system. So you think about the muscles kind of work on their own for some of the time because they help with you being continent and help with sexual intimacy type of things. But some of the times you have control over some of the muscles too. So the nerves that go to it have part of our fight or flight system. And so if we are ramped up and in that sympathetic drive where, we have a lot of stressors going on in like all aspects of life, commonly the pelvic floor will respond with having more tension, just based on how the nerves are wired to the pelvic floor.
So then you can
So
get constipated from that, right?
yes, breath holding, if
Right.
people tend to clench their jaw, things like that. Yeah. So that helps me see like, okay, they might be holding a little extra body tension. So we might be working on how do we let pelvic floor then not
Relax.
just work on strength, we're working on letting it lengthen in that regard. But it may be kind of a bigger thing where do we need to have, would they benefit from some intervention? I do a depression screen on all of my intake forms, again, because people might not be asking these questions. And I have
Sure.
had some people say, I would like help finding someone for mental health. And then I help them do that.
I'm just blown away at this moment because there's like two parts of the pelvic floor. It's too tight and then it's too loose. I mean, in a
Mhm.
nutshell. I mean, I'm sure it's
In a
deeper
nutshell.
than
Yeah.
that, but am I
Mhm.
right?
Yes. Yep. And interestingly,
I
I
had
see
no idea.
people that have more tension in their pelvic floor.
Wow.
Oftentimes, the bigger issue, I know, I never would have thought that when I first, when I was in PT school, there it was like everyone just has weakness. And now on the internet, it's like, okay, do all these Kegels. But oftentimes, like that is not the issue with people with chronic sitting or constipation or stress, endometriosis, things like that. That's a lot of times pelvic tension.
Okay. So how do you know if you have which one you have? Or yeah.
So sometimes by the symptoms, I already, I do the intake, I read it before people come in,
Right.
but I try to keep an open mind because it may be I do an exam and it's totally different than what I think. So part of it is the physical exam. Usually you have some clues. If someone's having pain, say with a bowel movement or having pain with intercourse, it's probably related more towards muscle rather than like a weakness issue.
Can you go through some of because Leah and I will keep going with our questions, but
Oh my
can you
God.
go through some of the screening tools that a person can do to know they need to come see you?
Yeah, there are a couple, and one is someone can look up on the internet. So
Mhm.
it's called the Cozine COZEAN, pelvic dysfunction screening protocol. So there's some questions that you can just go through and say like, okay, I thought that was normal. And okay, maybe I would benefit from pelvic and pelvic therapy. No, there are physical therapists that do pelvic health and occupational therapists as well. So
Oh,
I just default to say physical therapy, but occupational therapy
What's
is.
one example of a question on that protocol?
So since we were talking about urination, it says it says sometimes experience one or more of the following urinary symptoms. One is accidental loss of urine. So that could be even drops. So we count that.
okay.
Feeling unable to completely empty your bladder, having to urinate within a couple of minutes of the previous urination, having pain or burning with urination, or difficulty starting or frequent stopping during your urinary stream. So, but again, thinking that a lot of these things you can do something about.
I think, okay, I don't know, but this is my image, and you correct me if I'm wrong. I think that most people, I'm older than Leah, at my age, have some issue with this. Is that correct?
That is a correct assumption. There's this model called the lifespan model, and you can kind of say like this for any muscle. Like you start off and with muscle like in your teeth and things are strong, but over time there's a decline in muscle. It is a little bit a sharper decline around perimenopause and menopause because of decreased estrogen. And this is all muscle, including the pelvic floor. But there are some things that create a little more challenge to the pelvic floor. And that could be pregnancy in general, even with a cesarean, could be a vaginal childbirth. And if there's any kind of extra tearing and things like that there. So, but you can make some improvement in most cases. So muscles do best when we continue to move them. So same as your whole body, there's a big movement in the perimenopause, menopause world for strength training, which I'm totally a proponent of, but that can include pelvic floor. So it doesn't mean you have to do Kegels all of your life, but that can be something that can help even general exercise and in some cases can really help pelvic floor. I sometimes am referring patients back to their physician to see if a topical estrogen around the urethral area, so the outs like right where you pee and like a vaginal area, can be helpful in people that are in perimenopause and menopause. And there's some great people out there. Rachel Rubin, as a physician, has some great information. She's in DC, but has tons of YouTube videos and I think she was just on another podcast, a big national one. So I don't know if I could say it here, but they very, very well done in the past week and just touched on topical estrogen. So just thinking like we lose estrogen everywhere and around the urethra, the tube where you pee, there's a ton of estrogen receptors. So it is plausible that even just using that can help support the urethra and decrease leaking. So
Gosh.
it's not just pelvic floor. It could be also that. And I use it. So, but it's not for everyone. So
Yeah.
I don't prescribe medication. So I just help people maybe connect some dots and then have just some talking points with their doctor.
So if I was to
Yeah.
come see you, maybe, I don't know, but if I was to come see you, what kind of, I know depending on the particular issue, but what kind of therapies do you do? Do you teach people exercises? I mean, what does it
Yeah.
typically involve?
Yeah, so I usually, in my evaluation, I usually look at your olive range of motion of your spine and your hips. I look at your breath, how your deep breath is. I look at how you utilize your core and your abdominal muscles, like what exercise that you're doing. If you have any scars, like if that is like, say, someone had even like a appendectomy scar, is that something that's creating a little tension down into pelvic floor? So I look at all of those
Oh,
type of things. So looking more like outside of the pelvic floor. One piece of the puzzle can be assessing pelvic floor directly and with an internal examination. So I talked about the The ultrasound is one external option, but what we do internally is assess for if there's any pain. It's not meant to be a painful exam, how well the muscles contract, how well they let go, and that can help give us information on do we need to work more on like hands-on therapy? Maybe there's some tight areas or scar that we need to work on. I do a lot with breath work, nervous system. And then again, with exercise. So yeah, so I just moved to a new office back in October so I could have the space. I have a rack and weights and barbells, dumbbells, just so I can, people that do weight lift or people that want to learn how to weight lift can do it in a space where there's no one else around and they can learn how to work on weights, but or maybe someone who is leaking when they do a certain barbell lift, and now they can end up. I could put the weights on. We can simulate that in real time.
Wow.
So I do. I'm a big proponent of movement and exercise, but the hands-on therapy can really help someone with there's some like sticky points that just should be moving better. That might just help, or pain points to help them be able to move and mobilize better.
Thank you. I really appreciate you talking to us and answering all of
I
our.
almost want to do a part 2 because I feel like we didn't touch on so many things.
We might have to have you back on.
Yeah, I would totally do that. Thank you for having me
Awesome.
on.
Yeah,
This
I'm
was
sure
really
so
good.
many of our members are going to ask more questions. We'll have to keep a list going.
Yeah, I would be happy to answer more questions.
Oh,
Thank you so
so
much.
Okay, thank you. Take care.